he wants to know about the potential of these drug treatments. There are a couple of drugs. Can you talk about that, Dr. Oz?
So there's several different approaches. The one that was studied by the French was based on an experience that was in China. The Israelis have tried this tactic as well, and it's being used quietly in some places, I'm told. But in this country, because these are repurposed drugs that were originally used for different ailments, we've not been exposed to this possibility. But here's the deal. You take a drug that was used for malaria, originally approved in 1955. We use it now for autoimmune problems, rheumatoid arthritis, and other conditions. You take that drug and you mix it with a drug like Z-Pak, which is an antibiotic, but it seems to have some antiviral activity. And that combination gives the results I spoke of earlier. Again, I'm just briefly saying it halves dramatically the amount of virus particles and ultimately shuts down the virus in your body within 6 days. Now, we've got to prove that in the randomized controlled studies, which Dr. Fauci highlighted in his comments. But President Trump was optimistic. He's saying what many people, lay people would say about this trial. Yeah, you didn't do it all the way you're supposed to do it. Doesn't cross the T's and dot the I's. But it's sort of intriguing that you gave a bunch of people this cocktail of drugs and it worked, and the people who didn't get that cocktail of drugs didn't do well. So although it wasn't randomized, it's still an interesting comparison. And I think the FDA is so and appropriately interested in this that they will fast-track studies right now. But we need to move quickly, because if we run out of supplies, this may be the main backup.